Hey there, and welcome to your NCLEX RN preparation session. Get ready to take your exam preparation to the next level with these practice questions. On your screen, you'll see two main sections, the question on the left and the answer choices on the right. But here's where it gets interesting. I'll read each question out loud, and as I do, you'll see a red highlighter moving along, keeping you focused on exactly what matters. I'll show you why the correct answer is spot on, and we'll dive into why the other choices just don't fit. Plus, I'll share some pro strategies to help you tackle questions like a true NCLEX champion. Ready to crush it? Let's dive in.
Sarah, a 28-year-old woman, visits her gynecologist complaining of irregular menstrual cycles and difficulty conceiving. After a thorough examination and tests, she is diagnosed with polycystic ovary syndrome, or PCOS. The doctor discusses treatment options and lifestyle changes to manage her condition effectively. Which of the following statements from the nurse regarding polycystic ovary syndrome management is incorrect? The options given to you are: Option A, maintaining a healthy weight through diet and exercise can help regulate menstrual cycles. Option B, birth control pills can help regulate menstrual cycles and reduce androgen levels. Option C, metformin, a medication used to treat diabetes, can help improve insulin resistance associated with PCOS. Option D, frequent monitoring of hormone levels and ultrasound scans are necessary to manage PCOS. E, surgical removal of cysts on the ovaries is a common treatment option for PCOS. Option F, following a high sugar and high fat diet can help alleviate symptoms of PCOS. The answers we are looking for are options E and F. Option A is correct. Maintaining a healthy weight can help regulate menstrual cycles and improve symptoms of PCOS. Option B is correct. Birth control pills are often prescribed to regulate menstrual cycles and reduce androgen levels in women with PCOS. Option C is correct. Metformin can help improve insulin sensitivity and regulate menstrual cycles in women with PCOS. Option D is correct. Frequent monitoring of hormone levels and ultrasound scans helps in managing PCOS and monitoring response to treatment. Option E is incorrect. Surgical removal of cysts is not a common treatment for PCOS. Cysts typically resolve on their own and are not the primary focus of treatment. Option F is also incorrect. Following a high sugar and high fat diet can exacerbate symptoms of PCOS by increasing insulin resistance and weight gain. A balanced diet is recommended for managing PCOS symptoms. Which of the following is the most appropriate nursing intervention for a patient with Addison's disease experiencing an acute adrenal crisis? The options given to you are: A, administering IV fluids containing dextrose. Option B, administering high doses of glucocorticoids. Option C, administering a potassium-sparing diuretic. Option D, administering beta-adrenergic blockers. An acute adrenal crisis can occur when the patient experiences a sudden and severe worsening of symptoms due to stress or illness. Nursing management of a patient with Addison's disease during an acute adrenal crisis is critical, and it involves prompt intervention to prevent life-threatening complications. Your options are: A, administering IV fluids containing dextrose. This option is partially correct as it addresses the fluid and electrolyte imbalances that can occur during an acute adrenal crisis. Addison's disease patients may experience hypotension, dehydration, and hyponatremia, which can be corrected with the administration of fluids containing dextrose. However, this option does not address the underlying cause of the crisis. Option B, administering high doses of glucocorticoids. This option is the correct answer as it addresses the underlying cause of the crisis, which is the lack of cortisol production. Patients with Addison's disease need lifelong replacement therapy with glucocorticoids, and during an acute adrenal crisis, high doses of glucocorticoids are necessary to prevent life-threatening complications such as hypotension, shock, and renal failure. Option C, administering a potassium-sparing diuretic. This option is incorrect as it does not address the underlying cause of the crisis. Potassium-sparing diuretics are used to treat hypertension and edema and can be harmful to patients with Addison's disease who are already experiencing electrolyte imbalances. Option D, administering beta-adrenergic blockers. This option is incorrect as it can worsen the patient's condition. Beta-adrenergic blockers are contraindicated in patients with Addison's disease as they can mask the signs and symptoms of hypoglycemia, which can be life-threatening in these patients. Furthermore, beta-adrenergic blockers can exacerbate the hypotension that occurs during an acute adrenal crisis.
By the way, the strategies we've been talking about in this video, those approaches for tackling tricky NCLEX questions and managing the different types of questions are actually taken straight from a resource I really recommend: the new NCLEX RN Practice Question Bank. If you're looking for a great way to practice and apply those strategies, this book has over 700 questions that mimic the real exam format, and each one comes with detailed explanations that help you understand exactly why the correct answer is right and why the others aren't. It's a great way to reinforce the strategies we've been covering here today. This book is especially useful if you're struggling with the new next generation NCLEX format or just need a structured way to build up your confidence with daily practice. You'll find it's all about practicing smart, not just hard, and really honing your test-taking skills. So, if these strategies are helping you out, this book could be a solid next step to boost your preparation even further. Just thought I'd share that in case it's something you want to check out. You've got this.
A patient with type 1 diabetes mellitus needs insulin therapy for treatment. Which of the following type of insulin is safest to use in bedtime? Your options are Humulin R and Novolin R, Humalog. Next option, NPH, and the last option is Glargine. Take some time to think about the answer. All right. The correct answer to this question is Glargine. Glargine is a long-acting insulin. Long-acting insulin with Glargine and Detemir have a duration of action of 12 to 24 hours. Note that this is only the safest insulin for use in bedtime as it has very little chances of sleep hypoglycemia. Humalog is an ultra-short-acting insulin with a duration of 3 hours. It cannot be given at bedtime due to low duration of action. NPH is an intermediate-acting insulin. As it has 12 hours of action, is given twice in a day, but remember, not to give at bedtime as this can cause hypoglycemia at bedtime. As a nursing intervention, you should remember that it forms a cloudy suspension and can precipitate, so it cannot be given IV as if it precipitates, it can cause under or overdose. Humulin R and Novolin R are regular insulin. They have a quick onset of 1 hour, reaching peak at 2 hours and has 4 hours of duration. They also are not safe to be given at bedtime as frequent waking and injecting insulin may be necessary. Let's see another question. A patient with long history of diabetes mellitus is prescribed metformin. Which of the following is not correct for its right use? Your options are discontinue metformin 48 hours after any contrast test. Another option is give supplemental vitamin B12. Tell patient not to take alcohols during its use. Take with or after food. This is purely a knowledge-based multiple-choice question. We have to select a negative answer or incorrect answer for this question. Metformin, which falls in the bigonide group. Metformin works by decreasing the glucose production in liver and increasing glucose uptake by the body cells. Your answers are: the option we have to choose is the first option because it is not correct. You should ask patient to discontinue the drug 48 hours before, not after, any contrast test. Contrast dye, such as iodine contrast procedure for cardiac catheterization, can affect the kidney function of the patient, which would be pronounced by metformin as it causes lactic acid buildup. So, combination of these two would be disaster. This is the reason why metformin is stopped on the day or at 48 hours before contrast procedures. Second option, patient may be supplemented with vitamin B12. The reason is vitamin B12 is correlated with vitamin B12 deficiency. Third option, alcohol shouldn't be consumed concomitantly with metformin because it causes hypoglycemia. Fourth, to avoid the GI effect, it shouldn't be taken in an empty stomach. That means it should be taken with food. Let's see another question. Mrs. Agrima is a 45-year-old woman who has recently been diagnosed with Addison's disease. Mrs. Agrima's medical history includes a history of autoimmune disorders, and she is currently taking corticosteroid medications for her autoimmune conditions. Which of the following is not a symptom of Addison's disease? The options given to you: A. Salt craving. B. Increased blood sugar. C. Electrolyte imbalances, including high potassium and calcium and low sodium. Option D, increased sexual performance. E, fatigue and weakness. Take your time. The correct answer is D, option A, B, C, and E all match the symptoms of Addison's disease. It is important to note that Addison's disease is characterized by decreased sexual performance, not increased sexual performance. In comparison, Cushing syndrome is characterized by hypersecretion of adrenocortical hormones and symptoms that are opposite of those seen in Addison's disease. Symptoms of Cushing syndrome include weight gain, round face, thin skin that bruises easily, purple stretch marks, and excess hair growth.
Hey, I just wanted to quickly share something with you that I think could make all the difference as you prepare for the NCLEX RN. I know how stressful it can be, especially when you're balancing everything: clinical hours, coursework, life, and trying to carve out time to study. Trust me, I've been there. That's why I highly recommend checking out the 4 weeks to NCLEX RN questions and answers practice guide. It's a taken for preparation of this video. What's awesome about this guide is how it's designed specifically for busy students like you. It breaks everything down into manageable weekly goals, so you're not overwhelmed and you know exactly what to focus on each week. The structure is simple but really effective. Week 1 sets you up with foundational strategies and helps you get comfortable with the question formats. Week 2 digs into the core nursing concepts, things like patient safety, prioritization, and critical care. Week 3 covers pharmacology and body systems, which we all know can feel like a huge challenge. Then, Week 4 is all about practice realistic exam simulations and reviews that really help you gauge where you stand. What I love most about this guide is that it doesn't just focus on the right answers. It's all about understanding why the correct answers are right and why the others aren't. It really teaches you to think critically, which is such a huge part of the NCLEX. If you're looking for something to help you stay on track without adding more stress, this guide is worth checking out. I really think it could make your prep a lot smoother and, most importantly, help you feel more ready. Good luck. You've got this.